So I want to talk to you all about men in the field of nursing. I think it's well known that there are more women in the field of nursing than men. So there are a lot of stereotypes associated with that. I don't know if you could take a minute and talk about, I don't know if you ever thought about the stereotypes when you were thinking about getting into nursing, and then also, what your thought process was and made you realize that, the nursing is the right field for me, and I'm going to be a male in the nursing profession.
Being a man in nursing is, to me, I don't even really notice that, like, there's really discrepancy in terms of, like, men and women. Like, I'm just so used to being in it as being a guy that it doesn't really, like, have a stereotype on me anymore.
So the stereotypes, you'd say there's really the things of the past, and
Yeah.
and men in this profession, now they're really in demand.
Yeah, and like none of my friends are like, oh, what are you doing? Like, you're a nurse. Like, no one says anything. Like, they're actually, like, proud of me for being a nurse. They think it's admirable.
I would encourage any young man, any non-traditional student, to go into the nursing field. It's very rewarding. You learn a lot. You help people, like Alex said, and that's always been a big thing for me, is trying to help somebody. Always trying to help people. Why did I get into nursing? A lot of my family's in medicine. My uncle's a pharmacist, my mother's a nurse, a bunch of other people. I lost my father when I was 10, so I knew when I was getting older that I wanted to do something where I could really kind of step in. And working in the ER, in particular for me, has been more of one of those things, like, if I can make sure that I can if I can make sure that I can get Dad home this time, you know what I mean? Make sure that some other young child doesn't have to deal with what I dealt with, you know? So that for me is a big thing.
Okay.
Yeah.
Zach?
I mean, it's pretty much the same as Chris. With the population that I work with is more heavily filled with geriatric patients, and I think that's where the stereotypes come from. So I haven't seen it much, and it has been a very welcomed thing that I'm a man in nursing. Like, the little patient will be like, "Oh, you're a nurse," and I'm like, "Yep." They think.
Not to interject, but do you walk in and they call you doctor?
Yeah.
Every time,
Yeah,
right?
yeah.
They always think,
Yeah.
oh, I'm a doctor.
The guy who wears a stethoscope to
Yeah.
the doctor.
Yeah.
That's right.
Yeah, and I think especially for advanced practice nurses, it's probably even more common. Like, you just are the doctor now.
The doctor.
Yeah.
In nursing.
Yeah.
That's right.
But I mean, it's been very rewarding to hear that from the patients and be able to break the barriers and the stereotypes that go into it.
Right, so it sounds like everyone's gotten past, the male nurse label, and you're just a nurse now, just like everyone else in the profession.
Yeah, for sure. And it's funny though, because there's still only like a low percentage, like maybe 12% of nurses, registered nurses
13%, yeah.
are men. So
But that number's growing.
that number is
Yeah.
growing definitely, and I mean it needs to.
So you have the
There's no
entire South Jersey contingent of men in nursing here today at our panel. Is that what we're saying? Okay, Chuck, you want to talk about your experience with
So
that?
Jim and I are a little older, so I think about that impact a little bit of the stereotypes, but that has shifted. Definitely has shifted.
Okay.
Before, you were weak, you weren't smart enough to get into medical school. There's various reasons why. You were soft. But nursing is one of those professions where you do have an opportunity to make a change, and it is a calling. And I personally belong to Men in Nursing. There's a national organization, Association for Men in Nursing, and I think that's part that I like to be part of that group, just to be supportive of men. It's welcome to all nurses, male and female, of course, but it's one of those things where that has shifted. And I think now with Men in Nursing, with the numbers going up, approximately 12-13% each year, it will definitely help fill the nursing void. We are definitely short nurses across America, including South Jersey. You also, for some reason, we do hear that men are more compassionate and a little bit more gentle with injections and things like that too, which is, we're all trained the same way. So I'm not sure it's just a perception or why that is coming across, but we hear that a lot in our practice, which is very interesting.
For sure.
I don't know, your family members and stuff like, oh, I'd rather have a male anyway compared to a female nurse across the board. So
I've heard all of that many times.
That's right,
Yes.
yeah.
I did a COVID vaccine clinic where I was doing hundreds of shots a day.
Right.
You know, and they're like, oh, we love it. You know,
Yeah.
they're so good at it.
That's
Why?
right, yeah.
I don't know, I guess.
What's been your education?
That's right.
All right, Jim, and your experience with that?
Yeah, and there's times I think that male patients feel more comfortable having a man as their nurse as well, especially procedures, for example, getting a Foley in, they might feel a little embarrassed with a female doing that. You know, and as far as stereotype, I think I was a little bit diffused early in life as a young man because my brother-in-law was a nurse in the 50s into the 60s, and he was kind of my mentor. I liked hearing about his experiences, and he worked primarily in psychiatry.